But she's from Nicaragua, thought you was her.
Hey everybody, welcome back to my YouTube channel. My name is Monique and we're basically going to be talking about everything travel nursing. Stay tuned. Now, I recently got a comment under one of my videos. It was actually the first video that I posted. I'm going to link it up top. I'm not sure where I'm going to link it, but it'll definitely pop up around this time of the video. But essentially, I was talking about how I became a travel nurse after having only been a actual nurse for about 9 months. Now, considering the circumstances, we were in the middle of COVID, a lot of hospitals were short. I'm pretty sure, and I would not be surprised if that was why I got hired in the first place, but needless to say, it was done. So is it possible? Yes, you're gonna get a lot of no's, but again, yes, it is very much so possible. With that being said, someone left a comment under my video. I believe her name was Patrice Walker. The question was, hello Monique, I've been a new nurse for about 9 months now. However, I'm at a skilled nursing facility. And if you don't know what a skilled nursing facility is, that's basically when, let's say for example, the patient does not need the acute care attention that the hospital would give, or they're not as critically ill anymore. We send them to a skilled nursing facility or a SNF. That's also what the other name of it is. She says, I was a CNA at the hospital prior during nursing school, but wanted a break from the hospital. Long story short, do you think it is best to go back to the hospital as a new grad to get the experience in before doing travel assignments? So scared, so scared that acute care is so different from skilled nursing and I might drown. What's your take? Now, this question in itself is definitely multifaceted. And I wrote down a list of things. I'm gonna try to keep this video short, but I'll try, keyword try. Now, first things first, you've been a nurse for about 9 months. So that's already one thing checked off of your list, all right? You're essentially gonna be in the same predicament as what I was in, basically. Number 2, you said you're at a skilled nursing facility. Now, first and foremost, as was previously mentioned, right? A patient that will end up at a skilled nursing facility is typically going to be a little bit more stable than a patient that's going to be in the hospital. In most cases, and I've actually done this multiple times, especially at the place that I'm at right now, I've sent patients to a skilled nursing facility before, or a SNF. We also call it a SNF. I've sent them there on a vent, we call it long-term ventilators, or long-term trach care. At that point, they're used to it, but they're stable enough to be in an assignment with over 6 patients at a time. Because at a skilled nursing facility, the assignment does end up being like up to 10 or 15 at a time. What else? I wanted a break from the hospital, and that's justified because again, the hospital definitely is way heavier than in terms of the sickness or the illness of the patient. Hospital definitely is way different level, basically top tier. With that being said, because you've already been a nurse for 9 months, no, I don't think that you necessarily have to go ahead and enroll yourself at the hospital or get a job at the hospital as a new grad nurse. What I think you should do is just apply to the job, let them know that, hey, this is what your background is, and then they'll necessarily, transition you into the role. A lot of times, especially if the individual is coming from outside the facility, they'll typically train you for about a couple weeks. At this point, you would have been an experienced nurse for about 9 months. So in terms of the basics of nursing, like time management and all of that, you should have already had that down packed in those 9 months that you've been a nurse. One other thing that you also have to be mindful of is that within the hospital, depending on what floor you're gonna end up on, and considering that you did say acute care in your comment. So I'm gonna assume that you're either thinking of like an IMC, which is an intermediate care unit, or we sometimes call it PCU, which is progressive care. So either of those are used interchangeably. You can do, again, IMC, PCU, or ICU. Yes, the workload is going to be more because the patients are going to be sicker, versus in a skilled nursing facility, you have more patients, they're more stable, so you don't have to do much but manage them, right? Versus in a hospital, what you're in charge of doing is essentially like trying to prevent them from going the other way that we don't want them to go. Just as I mentioned before, they're gonna train you whenever you get to the hospital, whatever floor you're gonna be on. I know in the ICU, they typically do sometimes have a bridge program, depending on what the facility or where the facility is, whether or not they're a teaching facility. A lot of times they do have a bridge program, which will definitely be helpful for you in this case. Let's say if you were a new grad, so fresh out of nursing school, you went to the ICU or the IMCU instead of going to a skilled nursing facility. You would have had training for about 3 months. Now, considering again that you're coming in as an experienced nurse, your training is not going to be 3 months. It's probably going to be like probably 2 months, if at best, probably a couple weeks. And again, you'll be able to communicate with the manager or with your preceptor as you see fit, whether or not, you feel comfortable getting off of orientation at that point in time, or if you feel comfortable with like the workload, the medications, like, if you still have questions, and basically just overviewing like what areas you need help in before they take you off of orientation, and send you out to the wolves in essence. One thing I will say is that in comparison to a skilled nursing facility and let's say a med-surg unit, for example, yes, in essence, in some way, shape, or form, a med-surg unit is not as critical as probably an IMC or ICU. However, when it comes to a SNF facility, I've heard stories of a med-surg nurse being on a med-surg unit. She's had up to about 6 or 7 patients. Meanwhile, no one is helping her. This is on a travel assignment too. No one is helping her, okay? She has multiple infusions running at the same time. Either that or she still has to be charged. Now, depending on what facility you're at, if you're charged, you don't have an assignment. Or if you're charged, you do have an assignment, but it's gonna be the least critical patients on that unit. Now, if you catch yourself in a situation where you're on a med-surg unit and you have up to 6 patients and you have like multiple transfusions, it's not safe. It's definitely not a safe situation at that point. And this is in response to the part of your comment that says you may drown, okay? If you find yourself in a situation where you pick up an assignment, a med-surg assignment, right? And they give you all these patients that they're not all the way ICU, they may not be IMC, or actually they probably should be in the IMC, but they don't have an IMC in that facility. They have med-surg and ICU, that's it. And you find yourself with that workload, you're giving transfusions and all of that. In comparison to the SNF facility, yes, it may very well be about the same, because again, like I said before, you have your long-term vented patients or your long-term trach patients within your SNF facility, and depending on what their situation is, it can be a little bit hectic, just like that scenario that I mentioned a while ago within the hospital. So with that being said, I want to actually give you 2 scenarios, one being my mother's and the other one being mine. So my mother is an LPN. This lady, excuse my language, this lady makes money out the ass, like, plus she's Jamaican, so she gets her bag. But anyway, so she's an LPN, and I'm not sure if the facility that she works at is like a rehab / a SNF. But all I know is that the patient that she had was a trach patient. And this was a situation that happened before. The patient has hinted at wanting to pass and all of that, but I guess it was not really taken seriously. Conveniently enough, on her shift, she was there and the CNA came and said, nurse, come, the patient passed. And she went in, the patient passed. And why? Because the patient took the trach out. I'm telling you this because within that skilled nursing facility, or even if it was just a rehab center, either or, I know again that they have ventilators in those rooms, in those facilities, or they have trach patients in those facilities. And with you having up to like 15 or so patients, you honestly don't have the time to dedicate the time that you would need to really assess, like care for that patient, give them your undivided attention within that time frame that they really do need. I'm gonna follow this up with another story of my own. When I was in Albuquerque, I was doing 6 shifts back to back. It was just night shift, so it wasn't really too bad. Like, I was fine with that because night shift over there was pretty chill. The patient population was mostly like alcoholics, like mostly GI issues, cholecystectomy. A lot of people came in for bariatric surgery. So it was pretty chill for the most part. Needless to say, one weekend I decided to come home and pick up some shifts on this app that's called ShiftMed. Now, essentially, it's an app where if facilities in the area, like, again, rehabs, SNFs, whatever the case is, if they need additional help, they'll put the shifts up there, and then you have the option to go in and pick up the shift. You can be an LPN, a CNA, an actual RN, and of course, you're considered a travel nurse for them. So your pay would be higher within those 8 hours. So I decided, me as a hospital nurse, to go ahead and do that. Needless to say, I'm never doing it ever again, okay? I'm used to my 5 patients, and as heavy as they are sometimes, right? I felt so bad complaining after that weekend. I worked Saturday, Sunday. No, actually, no. I worked Friday, Saturday, Sunday. And after those 3 days, I felt bad complaining about my shifts because these people really do have 15 patients. When I tell you there was at least 1 or 2 times that I gave one patient the wrong medication, and my only saving grace was the fact that most of the patients on the floor had basically the same medications. They don't scan anything. It's like everything is literally in a bag. Like you go pick up the meds, you go around and pass around to the patients. I didn't feel safe doing that, me as a hospital nurse. Now, I'm saying this to say that if you are supposed to come from a SNF facility and go into a hospital, it's going to be a transition for you, but I feel like it'll be an easier transition versus me, if I was supposed to go from a hospital to a SNF facility like where you're at right now, that would be a harder transition for me. Yes, the patients in the SNF are a little bit more stable, but it's certain checks and balances that are in place. Like not only the fact that you have up to like 18 patients, 15 patients, 18 patients, whatever the number is, not only the fact that you have more than the conventional amount of patients, but also the fact that you get to scan your meds whenever you have to give it. So I feel like in essence, it's gonna benefit you more. So to cut a long story short, do I think that you should go to the hospital before you decide to do travel nursing? Yes, I do. Because it's definitely a different ball game. You should know, however, that depending on what the travel agency is, or who the travel agency is, or who your recruiter is, they can set you up to, well, it depends. They can set you up for good or bad. But essentially, all I'm saying is that they can set you up to be in a position to which way you're only able to accept contracts from like skilled nursing facilities. So even though you're within a skilled nursing facility, you don't necessarily have to work a hospital contract, if you get what I'm trying to say. There's, I forgot the name of this place. Something specialty, I don't remember the name of the thing. Like I'll figure it out and try to like link it. But I know my first contract, even though the name of my video says at 9 months, I actually got the first contract, I think when I was like 8 months or 7 months, and I didn't take it because I realized it was in the ICU for them. And then I would have more than the conventional amount of vents and all that I should have. And I honestly was not comfortable with that. So I did not go, did not take the contract. I felt bad at the time, but I'm like, nah, protect your license at all costs. So that concludes our video. If you do still have any more questions, please feel free to always reach out. Again, I'm so sorry that this took so long. I actually have to post an update video about how my life has been going so far, what I've been up to, just so you could get a better idea of why I went MIA. I really hope that this is the beginning of me getting back to basics, you know, and posting a lot on YouTube again, because I do know that there's still a good amount of people that want to venture into travel nursing. Okay, that being said, stay blessed, and it is Christmas, so Merry Christmas, everyone. Bye.